stakeholders, i.e. the local councils and the agency, because they need to have this work plan. I mean,
Victor Lansana Kuruma, Executive Director of Health Alert, giving an overview of a new initiative seeking increased domestic health financing in Sierra Leone.
What you are seeing today is just the eye-opener. In other words, you are saying we are launching. Now, the concept has been developed, approved by GAVI, but now the implementation starts today. We have not really done any implementation. Now, the research that is being conducted, part of this presentation is part of the research that the consultant is doing. And the second phase, like he said, is developing the domestic revenue resource plan, right? Strategy, okay?
The advocacy for increased finance and immunization for primary healthcare project is co-implemented by Health Alert and WashNet Sierra Leone, with funding support from the Global Health Advocacy Incubator and the Global Vaccine Alliance, or GAVI. The initiative aims to advocate for increased domestic resource mobilization to strengthen immunization, finance, and primary health care in the country.
The health finance in Sierra Leone continues to be very low than the recommended regional targets, talking about the 2001 declaration in Abuja, where we had an agreement that by 2030 we should be able to reach 50% of the total national budget. 50% of that budget should go to the health sector.
Nathaniel Suluku, a local consultant with Health Connect, presents findings from an analysis of the financial gaps and resources required to support immunization and primary health care in the country. This event, convened in the conference hall of the Freetown City Council, brought together key stakeholders from government, its development partners, civil society organizations, and community representatives, with the goal of fostering collaboration and driving sustainable solutions in the healthcare sector. The initiative comes at the backdrop of rising doubts over the sustainability of donor funding, especially in the face of massive aid cuts by US President Donald Trump's administration. Suluku's presentation reveals that Sierra Leone remains a high donor-dependent nation for health financing, for both primary health care and immunization. Immunization has been a key intervention by the Health Ministry, and its prioritization has witnessed an increased demand for funding over the years. GAVI has been a major source of funding for immunization in the country. Nonetheless, as revealed in the report, health financing remains very low on the basis of international standards, notably the African Union's target of 15% healthcare spending and the global target of 5% GDP spending on healthcare. While budget allocation to healthcare has increased over the last 5 years in Sierra Leone, it is still insufficient, according to the data.
The health workers program is quite a big program to support. So looking at the financing, the health financing, the money is going to the primary health care. It's also very important for us to note. So what internationally we are looking at is to have at least 5% of the health sector budget to be put aside for primary health care by international standards. That is what is expected. So look for 2020, for example, nothing actually was allocated to the primary health care as a program. Looking at 2021, we have a very static point here. In 2021, it was 0.3%. This is the total from the total health sector budget.
Consequently, Sierra Leone has a very high out-of-pocket spending on healthcare, 50.4%, according to the last National Health Account Study of 2021, the latest such data. The data shows that in the last 5 years, allocation to the health sector has fluctuated between 7% in 2020 and the highest at 11% in 2022. As of 2025, allocation to the health sector stands at 9%. Domestic funding on vaccine administration between 2017 and 2021 has been below 14%. This, according to campaigners, threatens Sierra Leone's prospect of attaining universal health coverage in line with the United Nations Sustainable Development Goals. But allocation is one thing, and execution or actual disbursement of funds is an altogether different thing, which campaigners say has been a huge issue over the years. seriously affecting financing for primary health care. Through this 9-month-long program, Health Alert and its partners intend to change all of this through engaging key stakeholders.
We have the council is, for example, a training session on responsive budgeting, and resource management. So this will be done with the DHMTs and the local councils, finance officers, So that activity is very explicit and specific to the local council as an example.
Wednesday's event entailed interactive sessions, including a panel discussion pitting representatives of the stakeholders, including experts, civil society, politicians, and the health authorities.
Even with the donor support, it's not enough. We need more investment, and health needs to have that investment. And I said, if we don't meet even that 15%, it becomes difficult.